Good morning, everyone. This is Rafael Benavides. I am the Spanish Press Secretary here at the Texas Democratic Party. I hope you all are enjoying the change in weather, the cooler temperatures in this time of the year. So we're here today to talk about something very important and bring awareness and attention to a situation in South Texas, specifically in Laredo and in Webb County. We're joined today with a number of community leaders, including the Texas Democratic Party Chairman Gilberto Hinojosa, U.S. Congressman Henry Cuellar, representing the 20th District of Texas. We have the Webb County Democratic Party Chairwoman Sylvia Bruni. We also have representatives from the city of Laredo. We have District 4 Councilmember Alberto Torres Jr. We have District 8 Councilmember Alyssa Cigarroa, and we will also be joined by Dr. Ricardo Cigarroa. So we'll go ahead and get started. And today we're going to be speaking about discussing COVID and how it's been affecting the community in Laredo and in South Texas. It's been ravaging communities of color, specifically Latinos in Texas, and probably a community that has not been hit harder than Laredo. So to start us off, we'll get started with Chairman Hinojosa from the Texas Democratic Party.
Thank you, Rafael. First of all, I want to thank our leaders in Webb County for not giving up on our people. Since the start of the COVID-19 pandemic, Mexican Americans living in South Texas, particularly in the stretch between Laredo and the Rio Grande Valley, have been bearing the brunt of this virus at a rate 3 times that of their white counterparts. Mexican Americans also account for more than 1/3 of almost 72,000 COVID-19 deaths in Texas since the pandemic began. The truth is that the border communities have remained underserved by Governor Greg Abbott's disastrous COVID-19 plan and his vaccine rollout. For months, our frontline heroes and doctors have been asking the state for help as hospitals reach capacity and refrigerated trucks act as makeshift morgues. And while COVID-19 didn't create inequities in our state, it has most certainly been intensified in ways that we and the governor clearly see. In South Texas, we need a plan for the distribution of the COVID-19 vaccine that addresses the disparities between Black and Mexican American Texans in regard to their outcomes fighting this pandemic. Democrats have championed giving out survival checks to every South Texas family and call for a moratorium on evictions, as well as a real plan to help working people build out our economy and our communities back better. Just yesterday, President Biden's COVID-19 response team announced he secured 3 mass vaccination sites in Texas: Dallas, Arlington, and Houston. We need 1 in South Texas as well, and particularly with the state of Texas to vaccinate up to 10,000 Texas and underserved communities per day. This is what real leadership looks like. Together we stand to demand action and accountability for leaving Laredo and South Texas to fend for themselves, even as other communities outside the border appear to get more vaccines and better resources than this solid Democratic community.
Thank you, Chairman. Also with us today is U.S. Congressman Henry Cuellar, representing the 20th District of Texas. He's been doing a lot of work there in Washington, and we are very grateful to have him here today with us to talk more about the issues. Congressman Cuellar.
Thank you, Rafael, and I certainly want to thank the Chairman Hinojosa, and our local chairwoman also, Sylvia Bruni, a good friend of mine, and I know we got some of the City Council, Albert Torres, and also Ms. Lisa Cigarroa. I don't know if her dad is there. Her dad and I grew up together, and if Dr. Ricardo Cigarroa is there, I certainly want to say hello to Dr. Cigarroa also. But I want to thank everybody for pointing out that we got to do better down here in South Texas. And let me just walk the process and why this is a little frustrating. The federal government put in billions of dollars to develop the vaccine. The vaccine, as you know, usually takes 5 to 10 years, but we were able to do it in about 10 months. One of the fastest times to put a vaccine together. Then under the prior administration, the Trump administration, if you recall, they had this military person that was talking about logistics. And he talked about how they were going to get the vaccines over, put them in UPS, Federal Express, get them over. The problem was under the prior administration, under the Trump administration, it was, let's take Texas as an example. It went from Washington, or the place of production, to Austin, and that was it. And even though the state had 10 months to prepare for this, remember, the state had 10 months to work out the logistics. When we get the vaccines, how are we going to work this out? And as you know, even with those 10 months, the state has not been ready to do its job. And certainly here, I know Sylvia and Albert and Elisa and other folks are going to tell you what's been happening here in Laredo. Laredo was one of the hottest spots for COVID-19. The problem is that what the Trump administration should have done, and what President Biden is doing, is it should be from Washington, or the place of the vaccine, not to Austin, but get it to the arm. So it should be from Washington, the place of production, to the arm, and not get stuck in the logistical issues in Austin, Texas. So we're seeing that, and now under Biden, we're trying to get that. And under Biden, we got now CVS, Walgreens, you're gonna have Walmart, and other entities that are going to be getting those vaccines directly, so we can get the private sector to get them instead of them being stuck up there in Austin. The other thing is, and we'll be making an announcement pretty soon, is the community health centers on a pilot program. One of them in my district will be getting vaccines directly. And as you know, community health centers are so important for the rural areas and for the areas that are poor. And that getting those vaccines together are going to be important. And what President Biden and the Democrats, what we've done in 3 weeks, just 3 weeks, we have increased the production of vaccines by 28%, just in 3 weeks since the President Biden got in, 28%. So that means there'll be more vaccines that will be coming out to the public. On top of that, we're waiting for Johnson & Johnson. And as you know, once that gets approved, the one dosage, that basically means that we will have, if everything goes to plan, another 100 million vaccines that will be available for Americans. So what President Biden and what we're doing in Congress is to build up the production and to say, from the vaccine production place, not to Austin, with all due respect to Austin, but to the arm. That's the way, that's the logistics that President Biden has been working on to get done. We've done, of course, our work. We put our monies at the federal government. And I remember talking, I asked Dr. Fauci, I think it was a day before that famous day where Dr. Fauci threw that ball at National Park, where it kind of went one way, but y'all remember that. But I told Dr. Fauci, I said, one of the things that we have to be very careful about, Dr. Fauci, is that I worry about the border and the rural areas not getting the vaccines. This is before the vaccines. And he said, no, we're going to do everything possible. But the problem is, I don't think Dr. Fauci understood that it was going to get stuck in Austin, Texas. And that's what we're seeing, the way that it's being distributed. And I'll conclude with this. I called the governor's office, and I asked the person I spoke to, I said, look, let me get this right. The federal government, we put in billions of dollars to produce the vaccines. The federal government provides the state of Texas billions of dollars so they can distribute. This is not state dollars. These are all, everything is federal dollars that we provide. And let me get this right. We do this, I sit as the only Democrat in appropriations in Texas, and I have to call the governor's office to beg them to get vaccines to Laredo, Zapata, Encinal, Wilson County, Atascosa. I said, do you understand why this gets frustrating? We give it to you, and then we have to call you and beg for that to come down here to my district in Laredo or in other areas. I said, there's something wrong with this system. And that's why under President Biden, we're trying to get those vaccines directly to the arms by using some of the other processes or entities that I mentioned. Let me just finish this. I also sent a letter to the governor saying, hey, let's use the National Guard and other folks. The federal government will reimburse you 100%. but let's get some of those folks to help us, because there are some people in the rural areas, or even in Laredo, for example. There's some people that can't get, elderly people can't get on the internet. There are some people that are home and can't move. Somebody has to go over there. They're not going to be driving, and we got to get them where they're at home. So those are the issues that Gilbert, Chairman Hinojosa, Sylvia, and the rest of the folks are talking. Those are the issues we're trying to emphasize. We have to do better, because it is a life and death decision for a lot of people. Like we've seen here in Laredo, more than 600 people have died in Laredo. So we're working hard, and we appreciate Chairman Hinojosa, you and Sylvia Bruni, and all the local leaders and the other folks working together as a team. Thank you.
Thank you, Congressman, for all your hard work in Washington. Next, I want to introduce our Webb County Democratic Party Chairwoman, Sylvia Bruni, who has, much like many of these panelists, led the fight to make sure that we get the adequate share of vaccines and attention in Laredo that has been so devastated by this virus. Madam Chair.
Mute.
You're muted.
There you go. There you go. First things first. Un gran abrazo, Chairman Hinojosa, desde su condado de Webb. One of the reasons why I love this Democratic Party of ours is because we really, truly believe that when we do things together, we're going to do so much better than when we try to do it alone. And I will never forget, Chairman Hinojosa, the moment I emailed him one evening, it was close to midnight, after we had decided that we were going to work on a resolution, our Webb County Party, but we knew we needed help. And so I reached out to the chairman, and within hours, he had the Democratic Party behind us. I don't know how many folks know that our city council, our Laredo City Council, when this horrendous pandemic hit last March, and I'm hoping that our Councilman Torres will tell us a little more about it. But I don't know if the rest of the world knows that the city of Laredo leadership was one of the very first to follow the science. We were one of the first communities to shelter in place, to begin to encourage the mask, to restrict openings. And there was a lot of controversy because we had been hit broadside. People were stunned. But we had a city council that stood its ground. And I am convinced, Councilman Alberto, that you saved lives. And then we saw the resistance. We had a president in Washington who was determined to play this down. And before we knew it, we had a governor who took away all your opportunities and all the ability you had to shelter us in place and keep us safe. And then tragically, what was it, about a month ago that we became another first. I think even the New York Times reported that Laredo was the city in the entire United States with the highest number of infections per capita. And that's what made this Webb County Party of ours very, very, very upset. And so the conversation was, what can we do? We knew on the one hand that we had a city that was doing everything it could, but we also knew that we had a governor that was hell-bent on resisting. And so came a resolution. We had a Webb County Democratic Party that unanimously passed a resolution. On the one hand, reminding our city government that we stood with them. And on the other hand, reminding our governor that he needed to do a hell of a lot more to protect this community. But we knew we needed to do more. And that's when I reached out to Chairman Hinojosa. What can we do to get this story out? And that's what today is about. It's a reminder, and I am so grateful. We have a Congressman, Henry Cuellar, who has been a champion. We have a state senator, unfortunately, Senator Safirini wasn't able to join us, who's been doing her level best to get help. We have city and county government. We have an awesome hero amongst us, Dr. Cigarroa, who's been just absolutely a leader in championing what this county of ours needs. But we need to tell the story, and we need the community to know that there is a major, major gap in what the state leadership is doing for this community of ours. And that's what today is about. And I am very grateful for every single one of you who is here today with us. Thank you, Rafa.
Thank you, Madam Chair. Next, we will hear from Council Member for District 4 for the City of Laredo, Alberto Torres Jr. Councilmember, you're muted. It seems like we're having a little bit of difficulties with your audio. Councilmember Torres, maybe if you can call in. We'll get back to you. Let's now go to Councilmember for District 8, Alyssa Cigarroa, who's new in her position, but has been a champion for COVID and bringing awareness to this issue in Laredo and Webb County nonetheless.
Can you hear me now by any chance?
Yes, sorry. So Councilmember
Okay.
Torres, we'll go back to you.
I'm sorry. Thank you all very much. It's great to see all of you here, so many familiar faces. Thank you, Chairman, or Judge Hinojosa, as I call him. I had the pleasure of working alongside him when I was county chair, and I appreciate the efforts of Sylvia, Chairwoman Bruni, who I know I left the local party in great hands, possibly better hands. Thank you very much for your efforts and for also expanding your role as a chairperson, especially during this pandemic. And also my gratitude to Congressman Cuellar for his continued leadership in helping Laredo. And of course, my colleague who I've had the pleasure of working alongside with, Councilmember Cigarroa, for also spearheading these many efforts in trying to combat COVID-19, even prior to her election as a council member. And we thank you and admire you for your efforts alongside your dad, who's been a great advocate and great community leader for Laredo. And we're blessed to also have him amongst us this morning. This has been a relentless pandemic that has stressed every sector in our local government. And when this pandemic first hit, I had the pleasure of serving as Mayor Pro Tem and in helping our mayor in trying to come up with the best approach of how we could fight this at our local level. And we knew that we had a challenge ahead of us being a border community. At first, we activated our emergency response plan and exercised existing protocols, but the emergency never went away, unfortunately. At first, the city of Laredo took swift and drastic action, as Chairwoman Bruni mentioned, to protect our people, because we felt and we continue to believe that that is our job right now during a pandemic. And we were the first city in the country with an initiative that we introduced to mask everybody through an ordinance that had a hefty fine attached to it. With no leadership or guidance, unfortunately, from either the state or federal level, we instituted our own orders to partially close non-essential activities in our city that we saw help address the pandemic. The data showed that our actions worked until, of course, the governor took our powers away and instead provided a much more relaxed order that allowed for him, in his mind, the best of both worlds, which was reckless. Our city's cases quickly shot back up, to no surprise, and after that have not come down since. And unfortunately, like Chairman Bruni mentioned, becoming the city with the most infectious and hospitalization rate per capita. I'm here today to tell our story and to say that we really do need help from wherever it can come from. And just recently, Congressman Cuellar mentioned how mass and mega vaccination sites are coming to Texas. And it comes to no surprise that, like Chairman Hinojosa mentioned, 0 of those mass mega vaccination sites are in South Texas. And it's obvious that our governor is unfortunately playing politics when it comes to vaccine allocations. Comes to no surprise that, yeah, his re-election's coming in 2022, and that he's using this pandemic to his advantage to send vaccines to what I believe and what we see areas that are heftier Republican demographic voters, and nothing to South Texas, even to Laredo. We, through the efforts of Council Member Cigarroa, we've asked for the National Guard to be sent to Laredo. Few days after we submit our request, what does he do? He sends a National Guard, but not to Laredo, right? So we continue to see this being not only a political agenda from our state and governor, but also a battle of equity and equality when it comes to vaccination distributions. And we need to continue to fight the state government that does not give cities like Laredo, the Valley, El Paso, and all border communities the resources that we need for our communities in order to fight this pandemic. So I thank our leaders and our community for standing together, for sticking together during this time of need. And I thank the Democratic Party's efforts, both at the local, state level, and we are very hopeful that with the new leadership from the White House, from Washington, with President Biden, that we will start seeing this change, like Congressman Cuellar mentioned, and that we start seeing more true leadership so that communities like Laredo and the Valley and those border communities continue to benefit at the same rate as those communities in North Texas. So thank you all very much for having me, and thank you for putting this together. We appreciate your efforts.
Thank you, Councilmember. And now we will go to our Councilmember for District 8, Alyssa Cigarroa, who I introduced earlier. She needs no introduction. She's been an advocate for many issues, but most recently with COVID-19. Her and her father, Dr. Ricardo Cigarroa, have helped us make sure that we get attention to Laredo and to Webb County that has been suffering from this global pandemic. Councilmember Cigarroa.
Thank you, and thank you all for being here today and for your efforts and continued leadership for our community. So Laredo and cities on the border are faring the worst outcomes of this global pandemic. My father, Dr. Ricardo Cigarroa, and I have been very vocal on this issue because it is a reality that we see every day. I hear my father calling patients, letting them know that they're positive for COVID, and and when hearing that that they have to be sent to the emergency room, and families are fear even going to the hospital because they won't be able to be with their family members. They're barely able to speak to them, and so we see our healthcare workers and frontline heroes are seeing an entire generation in Laredo being robbed of their parents by this unforgiving virus. And the data was already there to show that places like Laredo were going to be hit extra hard. And many in our community are less likely to have health insurance, and many have chronic health problems like diabetes and high blood pressure, leaving them more vulnerable to serious illnesses. And we are a major port of entry as well, with no regulations when entering the country. And so in our state has never had a statewide shutdown, but as mentioned before, cities and communities issued their own stay-at-home orders, and Governor Abbott reopened all these places and made it a priority to get people back in restaurants, bars, and hotels as fast as possible, even as the numbers of COVID-19 cases continued to grow without any decline. And while we are here advocating on behalf of our community and patients in Laredo, this is a problem that is affecting Latinos across the state and the country, and it is morally irresponsible to continue to let our people die from preventable deaths. And so we must continue to press this importance and to encourage more resources and vaccines for our community. Thank you.
Thank you, Councilmember. And as Congressman Cuellar mentioned earlier, his conversations with Dr. Fauci. I believe we have on the call with us the Dr. Fauci of South Texas, as the New York Times put it, who has been leading this call for more attention and more resources to our area, Dr. Ricardo Cigarroa. Dr. Ricardo Cigarroa, could you please explain to media from across the state here today, what is the situation here in Laredo and in Webb County?
Well, thank you very much for inviting me, and to the Democratic Party, thank you for making sure that we continue to let the world know where we're at. Since the beginning, I have said that it's not going to be the hospitals, the physicians, or the nurses, the healthcare infrastructure that solve this problem. There are only two things that are going to get us over the hump. One is quarantine, and the other is vaccinations. Quarantine has solved all of the plagues that have come our way in the history of the world. And it's just common sense. And we need to go back to common sense. To the governor, shame on you. Laredo has been the #1 place in Texas for a month and the #1 spot in the United States. Shame on you. We have gone from 300 deaths to over 670 deaths, 120 deaths a month. Shame on you. To the people of Laredo, I've always said you have to think for yourself. #1 in the country. There's only one way to solve it and protect your family, your children, your grandparents, and that's to stay at home. To the city council, I commend you for what you did early on. And I understand that the governor has put handcuffs on us this last month. But at the same time, you must remain aggressive. You have to push. And nothing made me prouder than the last city council meeting when you finally did the right thing. The hell with protocol. Your fellow Laredoans are dying. The hell with legalities. And so I'm proud of you all. And I know you're on the hot spot, but keep pushing. The fact that you sent the city employees home, half the county employees home, the fact that the school districts finally did the right thing. It works. We're down 30%. We have room in our hospitals. We can breathe. We can take care of those who are extremely ill. We still had 2 days last week where we had 18 deaths a day. It's tragic. So keeping people at home works. When our hospitals are full, go back to that. It's a fluid process. As our hospitals are below capacity, we can start going back to work and getting out there, but it's a fluid process. When we're full, you got to do it again. Now let's go to vaccinations. It's disgusting what's happening with our vaccination process. And let there be no doubt that the border has been the bastard child of Texas throughout its history. #1 in the country, #1 in Texas for a month, and no response. You're exactly right, Councilman Torres. What are these super sites doing? They should have sent them down here 3 weeks ago. They should send them down now. We have over 40,000 positive tests. That means that we probably have 150,000 Laredoans that have already been infected. You get us 50,000 vaccines and vaccinate over 3 days, and I promise you, in a month we have herd immunity. And this is behind us in Laredo. You keep sending us a piddly 2,000-3,000 a week, we're going to continue to die down here. And it is on the governor's shoulder. And Henry, I commend you for talking about the National Guard early. But you know, sometimes we just have to say the hell with protocol. And the federal government has to see that there's injustice and they just have to come down and take over. And I think that with respect to Laredo, with respect to our border town, we need the National Guard here. We need 50,000 people vaccinated in 3 or 4 days. We have the border. The plasmeros, people that come across to give plasma, well, that's a farce. They're coming across somehow or another, they get a note, they have COVID, and where do they end up? They come running here to our hospital because Nuevo Laredo has no treatment. And that continues to occur on a daily basis. We need federal help, Henry. Our governor is not going to do it. And I know that I'm quite upset, but I see the deaths and I sign the death certificates every day. And there is no time. There is no time for committee meetings and talk and chit chat. We need Biden. We need Henry Cuellar. We need our state senator to say the hell with protocol. Bring the National Guard, vaccinate us, protect us. I love you all, and let's just do the right thing.
Thank you again, Dr. Cigarroa, for your work and for your advocacy on this issue. Now we will get into the question and answer portion of this press conference. I want to remind the reporters on the call, if you can please ask your questions in the chat room. Para los reporteros que están con nosotros, por favor, si pueden hacer sus preguntas en la sala de chat, por favor. So we're going to go ahead and answer some of these questions that we have. But before we do, I do want to recognize some organizations that are with us. We have LULAC, our local LULAC with us. We also have Webb County Treasurer Raul Reyes. We did have Cindy Liendo, Commissioner, Webb County Commissioner Cindy Liendo with us. She did have some connectivity issues, so she was not able to stay on. And of course, we did have Senator Saffarini, who was very much going to take part in this press conference, but had to continue working in Austin. So we appreciate her reaching out to us as well and her work on this issue. So the first question comes from Juan Rodriguez, and I'll issue it to any panelist who wants to answer it. It is in Spanish. He says, si me podrían decir en dónde está el problema por el cual el gobernador no libera las suficientes vacunas en Laredo, a Laredo y otras ciudades de Texas en crisis. ¿Acaso está siendo discriminante o racista? Porque nunca lo hemos visto preocupado por los problemas fronterizos y tampoco en esta pandemia. Would any panelist care to answer that question?
Oye,
From Rodriguez?
sí, Rafael, habla Henry Cuellar. ¿Cómo estamos, Juan? Saludos. El problema que estuvo abajo de la administración el presidente Trump es que las vacunas que el gobierno federal pagó se mandaron a Austin, y ahí de Austin tuvieron 10 meses para trabajar las logísticas, cómo iban a mandar las vacunas. El problema, como dicen todas las personas que están aquí, es que no están llegando en la frontera. Yo me recuerdo cuando lo pregunté directamente al doctor Fassi de Washington, no el Fassi de Laredo, lo pregunté, lo dije que era importante que la frontera y el sur de Texas deben de recibir esas vacunas. Eso fue un poquito antes. Y me dijo, sí, no va a haber problemas, pero no sabían que partes como el estado de Texas se iban a quedar abajo de la decisión del gobernador Abbott y no se iban a mandar. Es que parte es las decisiones que se mandan, y como dije ahorita, es curioso porque yo llamé a la oficina del gobernador y le dije, oye, es curioso que nosotros, el Congreso te manda las vacunas, te da el dinero, billones de dólares para las logísticas, y ahorita está un congresista pidiendo ayuda de las vacunas que yo te mandé de parte de los otros congresistas. Es que para la respuesta a usted y la respuesta al doctor Cigarroa, ya el gobierno federal, Biden y los demócratas, ya estamos tratando de mandar esas vacunas directamente. Ya estamos trabajando con H-E-B, CVS, Walgreens, Walmart, Sam's Products, y lo vamos a mandar vacunas. También el Gateway Community Clinic, que vamos a hacer un anuncio la semana que viene, un anuncio de vacunas para ellos directamente. Es que, como dijo ahorita el doctor Cigarroa, vamos a mandar esto directamente del gobierno federal a clínicas, farmacias privadas donde pueden dar estas vacunas rápidamente. También para concluir, nosotros esperamos tener la tercera compañía, Johnson & Johnson, donde es nomás una vacuna, ya listo, ya pronto, y ellos dijeron que lo pueden dar más de 100 millones de vacunas nuevas. Es que con esto, y como vamos a mandar eso directamente, no nomás al gobierno estatal, pero directamente a las compañías y clínicas, esto va a ayudar totalmente mucho más.
Rafa, can I jump in from the city's perspective?
Of course.
Juan, muchas gracias por tu pregunta y tiene mucha razón el congresista Cuellar, pero es mi opinión como regidor y como líder de nuestra comunidad, y lo hemos dicho anteriormente y lo he dicho a los medios. Nosotros creemos que al igual el gobernador sí está discriminando a las ciudades fronterizas como Laredo, y yo creo que es una discriminación política. ¿Por qué digo política? Porque no es ningún secreto de que las vacunas están llegando a las comunidades que tienen más votos republicanos que las comunidades que tienen votos demócratas demográficamente. Y la igualdad de la distribución de las vacunas y el poder que tiene ahorita el gobernador, como lo dice el congresista Cuellar, es en mi opinión, un abuso de su poder, porque como viene su reelección, el año que entra está asegurándose de que sus áreas donde hay voto republicano demográficamente esté asegurado, y como decimos en español, a la fregada con los demócratas porque no le ayudan en su reelección. Y es desafortunado de que un líder al nivel estatal está jugando política con las vidas de las personas, está jugando política con las vidas de las personas que al igual demográficamente, históricamente no votan por un republicano, y es desafortunado que durante una pandemia la política tenga mucha influencia en salvar vidas. Nuestra meta es tratar de poner lo más que podamos de vacunas en los brazos, como dijo el doctor Cigarroa, y hemos escuchado donde la semana pasada el gobernador nos mandó 5,000 vacunas sin darnos ningún aviso previo, y como lo discutimos el doctor Cigarroa y la regidora Cigarroa, nosotros pensábamos que era una manera de ponernos a prueba para ver si íbamos a poder manejar las 5,000 vacunas, y porque nos las mandó con muy poco tiempo, y con el esfuerzo de nuestros líderes locales, con el esfuerzo de nuestras autoridades médicas y con muchos voluntarios, le demostramos al gobernador de que si nos manda 5,000, 10,000, 20,000 o 50,000 vacunas, como dijo el doctor Cigarroa, vamos a poder vacunar más gente en nuestra comunidad. Pero nos tenemos que olvidar de los juegos políticos, nos tenemos que olvidar de las agendas personales, y tenemos que volver a enfocarnos en las vidas que están en riesgo por esta pandemia.
Oye, y otra cosa más, en 3 semanas abajo del presidente Biden, los demócratas ya levantamos la producción de vacunas por 28%. En 3 semanas abajo del presidente Biden, los demócratas levantamos la producción de vacunas 28% más que estaba abajo del presidente Trump, y esto va a ayudar mucho, especialmente cuando entra la tercera compañía. Esperamos con Johnson & Johnson ya pronto. Pero estoy de acuerdo con lo que está diciendo Alberto Torres y los otros. Es importante que ¿por qué estamos recibiendo menos y otras partes donde hay más republicanos reciben las vacunas más rápidas y cada semana? Y eso es algo que en la frontera estamos diciendo, oye, no se deben de olvidar, como dijo Alberto, el señor Hinojosa, la señora Bruni y las otras personas, Cigarroa también.
Thank you, Congressman and Councilmember Torres. Actually, this question is for both of you again. It's from Judith Rayo from Univision. She's asking if you could just briefly summarize or highlight what you had said regarding what is being done to help the people of South Texas, but if you can do so in Spanish.
Bueno, rápidamente, abajo del presidente Biden, los demócratas ya levantamos la producción de vacunas por el 20%, nomás en 3 semanas. Es que van a haber más vacunas. Y para no esperar totalmente en el gobierno estatal con Abbott, El gobierno federal ya está mandando, como ustedes saben, vacunas a H-E-B, CVS, Walmart, Walgreens, y también se van a mandar a las clínicas federales que tenemos en Laredo, que vamos a hacer un anuncio la semana que viene. Es que estamos tratando de mandar las vacunas directamente a las ciudades y como ustedes saben, esperamos en unas semanas vamos a tomar un voto muy importante para el COVID-19 que va a ser 1.9 trillones de dólares, que va a incluir más ayudas para las ciudades, los condados y para los hospitales y clínicas.
Por el lado del municipio y por el lado de la ciudad, desafortunadamente, como mencionó el doctor Cigarroa, nuestras manos están atadas. Están atadas porque al principio teníamos el poder y la discreción de poder hacer lo que podíamos para salvar las vidas y enfocarnos en el problema local. El gobernador está viendo esto en una óptica donde ve y justifica sus acciones porque está viendo el estado de Texas al nivel estatal, pero no nos brinda la oportunidad a los gobiernos locales para que podamos hacer algo para poder combatir el contagio del coronavirus, del COVID-19 a nuestro nivel. Laredo, el Valle, El Paso son muy buenos ejemplos. Aquí en Laredo hay más necesidad que en cualquier otro municipio que nos puede comprar el gobernador. Y la lógica nos dice que la asistencia debe de venir a los municipios que tienen este tipo de problema como Laredo. Y el gobernador nos tiene las manos atadas donde el gobierno municipal, local, el cabildo y el alcalde no pueden hacer mucho. Y lo que estamos haciendo y cómo vamos a seguir apoyando y poder traer atención a nuestro municipio va a ser mediante foros como estos, donde ponemos presión al gobierno estatal, donde tomamos acción como concilio, como cabildo, en mandarle un mensaje fuerte al gobernador de que las comunidades hispanas y las comunidades fronterizas como Laredo y no se van a quedar calladas y vamos a exponer las decisiones que está tomando como gobernador. Y lo único que podemos hacer nosotros, como mencionó el doctor Cigarroa, es desafortunadamente irnos en contra del protocolo para poder llamar la atención de nuestro gobierno estatal. Y agradecemos los esfuerzos del congresista Cuellar y de la administración presidencial demócrata bajo el presidente Biden, porque están cambiando el proceso para eliminar la política que Laredo y el estado de Texas está desafortunadamente siendo una víctima de ese proceso que al igual no trae igualdad a la distribución de vacunas. Pero al nivel local, nuestras manos desafortunadamente están atadas y no tenemos otra manera de tratar de ayudar a nuestra comunidad y salvar vidas más que llamar la atención del gobernador. Y lo hemos hecho. Lo hemos hecho varias veces y es obvio que al igual a veces nos convertimos la burla porque pedimos un recurso como lo pidió la regidora Cigarroa en nuestra última junta de cabildo de traer al National Guard a nuestra comunidad y a los cuantos días el gobernador responde a nuestra petición, pero no manda la guardia a la ciudad de Laredo, sino la manda a diferentes otras ciudades. Y es donde vemos que está el problema, pero seguimos peleando, seguimos unidos y seguimos peleando para poder salvar vidas en la ciudad de Laredo, Texas.
Thank you. We have a question here from Julia Wallace from the Laredo Morning Times. She's asking, or she says, has anyone heard any justification from the governor or the Department of State Health Services as to why Webb County has received such an unequitable number of vaccines while also sustaining the highest hospitalization rate in the state?
I think that we've pleaded, we've asked, we've begged the state to give us an answer, and we simply do not get one. The efforts that have been led by the council, that have been led by Councilmember Cigarroa, by several of our colleagues, including Councilmember Dr. Marta Martinez, have been those. Give us the answers that not only we want as leaders, but give us the answers that people want to hear. And although there is some communication with state officials through our health authority, through our mayor, through our management team, we do not get the answers that we are seeking. So we've asked and the answers do not come. And it may be no coincidence that the answers don't come because they do not want the answers to be revealed. But we've tried, we've done everything we could in our authority, and we have simply been ignored as a border community where we continue to argue where is the equity of distribution for vaccines based on need. The governor knows the state of the city with this pandemic. Our health authority, Dr. Trevino, makes weekly, if not daily reports. Dr. Hellerstedt at the state level, they know we have a problem. Why aren't we getting what we're asking for? And we continue to not have any answers to that.
Let me also
Rafael, can I?
say
Yeah.
something on this. Am I on?
Yes.
Yeah. Let me just say something on this, because I think one of the things that we also have to recognize is that it's not just a question of political retaliation. It's also a question of incompetence. I mean, what you've seen coming out of the governor's office is among the worst incompetence of any governor in the entire state of Texas and the entire United States. What he has done since this pandemic started is ignored the scientists, ignored what needed to be done, the medical professionals, and played politics with this pandemic. And then his attention is always refocused on other fringe issues that basically his base is more interested in, like, for example, punishing people who are involved with Black Lives Matter, or taking stands on the whole issue of choice with respect to a woman's right in our state. He's more interested in issues that are not important to ordinary working class Texans and families. He's not interested on those issues. He's more interested in the things that his fringe right wing of his party is telling him to get involved. And you see this over and over and over with this man. He has not governed for the people of the state of Texas. He has decided that he will only govern for the right-wing faction of the Republican Party. And that's the truth. And that's the basic reality here. Yeah, he doesn't like us in South Texas because we don't vote for him. But more than anything else, he's not interested in us because, we're not worried about those fringe issues that he's worried about. We're worried about surviving. We're worried about making sure that our people have adequate health care, and whether or not they're going to be able to have the resources to be able to fight this pandemic and do whatever is necessary. The primary example is the reason why he was preventing people like Commissioner Torres and the city council in Laredo from doing what needed to be done to protect the citizens of Laredo, was because the right wing of his party was saying, well, you need to be with Trump and you need to downplay this virus because economically we need to ensure that people are not prevented from going back to work because it's going to hurt President Trump in his election. Those are the things that he's focused on instead of the welfare of our people. And that's the saddest part of this. That is the saddest part of this, because he could have easily gotten a handle on this pandemic early on, done the things that Dr. Sigoroa has been talking about for a long time, but he chose not to do that. He chose to focus his attention only on what the right-wing fringe wants. I mean, they have taken the position that this is a hoax. And they took a position that this was a hoax from the very beginning. And he essentially agreed with them at the beginning. And then when he started doing things to try to maybe change his stance a little bit, he got attacked and he stopped. When his own chairman of the Republican Party got in front of the White House and criticized him for taking a stand, trying to maybe do a little bit to protect people, he backed off because he was afraid of what the fringe was going to do to him in his primary when he runs again in 2022. So that's what really this is all about. It's about a governor that is incompetent in his ability to govern, and we are suffering immensely on the border, particularly in Laredo.
Julia, just can you hear me?
Yes, Doctor.
Yeah, so Julia, I think just a few more comments. Incompetence is exactly right, Gilberto. But with respect to vaccination again, do you know how many people in Laredo have had their 2 vaccines? Only 8,000. 26,000 have had their first. We have 40,000 positive in Laredo. Let's say it's 70,000 for people who haven't checked. Add another 26, so maybe 100,000 of our population is somewhat protected, because I think patients who've had COVID are somewhat protected. We have 200,000 people out there, Henry, who have not been protected, who are susceptible to this. Our governor has made it clear that he's not going to help us. When we asked for the National Guard, he wrote a letter the next day. I'm sure you saw it, Alberto, Alyssa. That letter, if you read it, was, we sent so many FEMA nurses, we sent so much PPE, we sent, 3 tents to help you. If you look at that letter, the verbs are all the past tense, not of what he was going to do to help us, what he had done. And FEMA, tents, all that stuff doesn't solve the problem. It helps us take care of those who have been sick. It doesn't help us reduce the input of who's going to get infected, and it doesn't help us vaccinate. The only way we're going to do this is for the federal government to take over, because our governor is not going to do it. He's put his head in the sand, and he's not going to do it. And we're not going to stand for it. And remember this, history is going to remember how we demic. Laredo, the Hispanics are going to remember. We love, every single one of us love our community of Laredo. But every single one of us, we're going to go way out on the branch. And we're going to rattle the cage, whatever the consequences are. Because this isn't over for us. But it can be. And that's the sad thing, it can be.
The federal government is starting to bypass and do things directly because it's not working with the state. The state had 10 months to work on the logistical issues on the vaccines. Either they're very incompetent or they're making decisions, as Gilberto said, to send vaccines in other places. It's one or the other or both of them together. And we all have our own opinions on that. So I want to say thank you to all of y'all. I have to get on. I got 3 Zooms and then I got to go sit down with Border Patrol because we have another issue. They're starting to release people in our communities without COVID-19 that are coming in. And what we're seeing right now, and I'll have a press conference tomorrow, Albert and Alisa, this is what I'm seeing right now. If you are undocumented and you fit the certain profile, they're going to release you here without doing COVID-19. But if you have a border crossing card, they're not letting those people in, or except the exception you mentioned, Dr. Figueroa. So we got another situation that we saw in 2013, 2014, and 2019, except this time we're going to be a pandemic because they're starting to release people here without COVID-19 tests. And if somebody gets sick there, you know what Border Patrol is going to do, Dr. Figueroa? They're going to send them to the hospitals, and our hospitals are overloaded. So we'll be talking about this issue. I got to get on the phone and talk about that issue. Then I got a meeting with Border Patrol and CBP on this other issue that we face. And so I have to go because I have to do another Zoom. But thank you. I want to thank everybody. Chairman Hinojosa, Chairman Bruni, councilpersons Torres and Figueroa, and my good friend Dr. Figueroa. We have to go meet at Haikitos and have some sushi there together and continue on that. So I appreciate you. You and I have known each other since we're this tall. My dad used to work for your dad, so we've known each other, and nobody else has the passion like you do for the health of our community, and I want to thank you for that. So with that, thank you so much, and I'll be available tomorrow for that press conference on the other issue, which is tied into this issue. Thank you so much.
Congressman, for your time and for your leadership. We are running out of time. I just want to give an opportunity to Madam Chair Sylvia Bruni. I know you haven't had a chance to respond to a couple of these questions, but I do want to give you an opportunity to share a couple of thoughts before we end this press call.
A couple of comments. One, and this goes to our city leadership, to both Councilman Torres and Councilwoman Cigarroa. I'm looking at LULAC also. There's already a conversation developing amongst our Webb County folks about what more can we do. And we know that there is a population in Laredo that is particularly vulnerable, perhaps the elderly, who aren't able to get to the vaccination sites, who aren't able to get into the websites. And so we're going to ask you if there is anything that we can do as a Webb County Democratic Party to help. Please reach out to us because we're ready to help. That's one. And the other is huge gracias. Thank you to every single one of you, particularly our media, to our leadership, because we wanted as a Webb County Party to let the community know that we are very concerned, that we very much support those of you who are doing your best, that we are particularly distressed over the lack of leadership at the state level. But we need help in telling the story. And when we have a gathering such as the one that we had this morning, we are in awe, very, very grateful. And that's what I want to make sure that every single one of you is aware of, how grateful this Webb County Democratic Party is to every one of you. Thank you, Rafa.
Thank you, Madam Chair. And to all our panelists, thank you for joining us today, taking the time out of your busy days. If anyone wants to mention anything else before we leave, feel free to go ahead and mention it. If not, we will conclude this press call. All right, thank you all again. And if you have any further questions, please email them to press@txdemocrats.com. And you can also visit texasdemocrats.org. Thank you so much and have a great day.